Hello and welcome back to Medicine Chopped. Mwasia Wanjiro here, welcoming you to our 4th episode where we'll be talking about ulcers, and we are going to be making a dessert, and our dessert today is French toasts. I know it can be used as lunch, brunch, breakfast, but I'm making it as a dessert, and this can be served for 6 people or however you feel like you're going to share it. And thank you for going along with us for the journey, and I'm going to be posing some questions at the community tab about what you want us to talk about, what you want me to make, and please comment, answer, give me ideas of what you like for us to continue about. So thank you, and let's get to this started. The thing about ulcers, that's a general term, but in the medical term we call it peptic ulcers disease. And for this, it's divided into 2 types of ulcers, and that's gastric ulcers and duodenal ulcers. The thing to differentiate is that gastric ulcers, whenever you eat, it takes around 2 to 10 minutes for you to start feeling the pain. And as for duodenal ulcers, it takes around 2 to 3 hours for you to start feeling the pain. Then for ulcers, the symptoms are usually chest pains can be one of them, but the most common symptom is usually something we call epigastric pain or upper abdominal pain, and the pain is usually situated at these points. Sometimes the pain will radiate, or it will move from this point to the mid of your back, or it will move even to your upper back. Okay, sometimes even the pain can move to your arm. So this pain is usually described as a burning pain. Sometimes you feel that burning pain, sometimes you feel like something is pulling your insides around this region, and sometimes that pain goes to your chest in that manner of pulling it. You might even think that you have a chest infection, whereas it's the ulcers that are causing this pain. And generally ulcers are like if you've ever had what is it called, a wound that is caused by flu, those that occur mostly from on your mouth, like on your lips, inside your lips. So like those wounds are forming inside your stomach and inside your duodenum. So that's what usually happens, and the more that you irritate these ulcers, the more they keep becoming huge wounds, the more they keep what can I say, like they keep becoming deep inside your stomach lining. The other symptoms of ulcers include headache, vomiting, nausea, diarrhea. We also have gaseous abdomen and abdominal fullness. So the ones that I've said after epigastric pain, those sometimes usually do happen, not always. And another thing is that you can also have ulcers, but you are asymptomatic, and asymptomatic means that you do not have any of the symptoms at all that I've mentioned. The risk factors for ulcers, it's having H. pylori. H. pylori is a bacteria that's usually found in the abdomen or stomach. And the other risk factor is NSAIDs. NSAIDs are anti-inflammatory medication like ibuprofen, diclofenac, aspirin, that mostly are used for treating pain. For if you have an inflammatory disease, they are used to, like arthritis, for example. Yeah, those are the 2 most common risk factors for ulcers. The predisposing factors of ulcers include stress, and stress occurs it makes it as in that whenever you're stressing too much, acid is produced at a higher level in your gastric, and this causes like the balance that's supposed to be there between the mucosal lining and the acid not to be balanced. Thus ulcers are formed. Another one is obesity, and a study that was done recently found that obesity is one of the predisposing factors. Alcohol is also another predisposing factor. investigations for ulcers include H. pylori test, which is done by a stool sample which is taken. And the reason why we are doing stool test is because blood was removed as a test. That is because as a person you form antibodies, and antibodies are formed whenever you fight a disease or a bacteria or anything. Thus, anytime you test your blood for this kind of disease or infection, the antibodies will always show as a positive. But when you test in the stool, you're checking for something called antigens, which when you get better from the disease, the antigens are no longer there. That's why you take the stool. Also, the stool can be tested for microscopy, which microscopy checks for other types of bacteria or viruses that can also cause ulcers at times or can aggravate ulcers. And please, my dear community or and family, do not self-diagnose using these videos. I beg of you, do not self-diagnose using these videos. This is just an education. In case you get these symptoms, in case you feel any symptoms at all, I would advise you to visit the nearest clinic or your doctor and have them check you out. Management for ulcers involves medication that when you test positive for H. pylori, you're given a H. pylori kit, which is usually a 2 weeks regimen, and it involves 2 antibiotics and 1 PPI. A PPI is let's say like omeprazole. An example is omeprazole, and it helps to reduce the acid that is getting produced. Then you might also be given an antacid, like the gel or liquid form or suspension form, which helps to reduce the hyperacidity that it's ongoing. In management also we have prevention, and for prevention of ulcers, you are supposed to avoid certain foods which produce too much acid. Let's say, for example, there is kales, there is alcohol, there is caffeine. Sometimes some people get it when they eat things like sweet potatoes, ripe bananas, oranges, limes, lemons, the citrus family, that is. Also we have beans. Beans usually produce a lot of acid, but there's some beans I understand that do not produce that much acid. I think the yellow beans. There's some also as a kind of peas that produce the acidity, but if you eat a certain food and you find that it gives you too much acidity or too much gas, it's better to avoid it. Another prevention is avoiding NSAIDs, and as I said, NSAIDs include things like ibuprofen, aspirin, diclofenac. And if you really need to use NSAIDs, you should go to your doctor and they'll be able to prescribe for you something, let's say for example a COX-B, which has less anti-inflammatory agents but produces much less acid, but still you'll be given alongside an antacid suspension to help balance the level of acidity produced. Another complication is that you might get an infection that is usually brought by when the ulcers go deep and cut deep into your, or eat deep through your gastric or duodenum, and they form a hole, and thus the contents of your stomach, the contents of your gastric, they spill in between your stomach and the skin or the inner part of the abdomen, and this is not something that's supposed to be there, so that will cause complications like infection, and this is an emergency. Actually, the bleeding is also an emergency. Another complication is that when the healing starts, the healing of the ulcers, what I can explain is that it doesn't heal like normally, like it will be smooth. Let's say for example, if I cut my skin, it will just become smooth again, but it forms a scar, and those scars, let's say for example, if it's acidity along your esophagus, those scars make the esophagus become thinner, and when it's thinner, then it becomes a problem for you to swallow. Sometimes you'll even feel pain when you're swallowing. And also another complication is that it might cause it might cause cancer, that is stomach cancer, and mostly because of the scarring, because new cells are getting formed. I hope you've gotten it that. For the emergencies, or even if you're in like you still have a recurrence of ulcers, that anytime you get treated you get a recurrence each and every time, the doctor will send you for something called an endoscopy or OGD, and that's a small camera that's attached to a small pipe that's taken down your throat to view how the ulcers look like, where they are situated, and sometimes through that process they can also stop the bleeding. They can also help to seal the bleeding that's taking place. Another test is ultrasound, the abdominal ultrasound, to see like if the peritonitis, the infection, as I said, for the abdomen is happening. Something I forgot to add is on the treatment part. When you're finished with the 2 weeks regimen, you get another additional 1 month of PPIs, that is omeprazole, esomeprazole. There are different kinds of PPIs for a whole month, but that one you take at least once a day to help you finish off the acidity. Then another thing you should note is that whenever you're taking this medication, please eat a heavy meal, because these are 2 antibiotics together, and even one antibiotic gives you a side effect. So imagine what 2 antibiotics will do to you. So please eat a heavy meal, then take the medication. And if you get any side effects, call your doctor, tell them about it. Some people will react to the antibiotics that are given in the kit, but there are other options where we can switch the antibiotics to something that won't react to you. The home remedies for ulcers include avoiding the foods that you've been advised by the doctor to avoid, eating 2 to 3 hours before you sleep, avoiding fatty foods, especially when you're going to sleep. Another one is you can use pepper, and when I mean pepper, I don't mean the powder, I don't mean processed, I mean the organic pepper, ama pilipili. That one is really good in helping with the acidity, and this happens in that when you take the pepper, it produces an element that helps with mucus production in your gastric. This counteracts the acid that is being produced. Thus, it covers the ulcers, or it covers or balances the acid that is produced. So those are the remedies that you can use. Yes. To conclude, ulcers can be treated. They can reoccur if you do not use the prevention method stated. And another conclusion is that please take care of yourself and eat healthy foods. That doesn't mean that you can avoid that chips, that burger, that fried chicken. No. Just be sure to know what you're eating and what you're putting in your body. Then next time we will be talking about urinary tract infection in men, and you're going to be making some grilled beef. Also, I thank you for watching us this far that you've come, and I'd like for you to just subscribe, watch and like it, comment, and come to the community tab where I said that we are going to be talking more. Share it with your friends. If you've learned something new, share it with someone else. Keep on spreading the word. That's the purpose of this channel, to share and educate the world. Don't keep it to yourself. Ciao.